But I'm not an employee of the Guild, contrary to what an awful lot of people believe. I am a working hypnotherapist. I volunteer my time to the Guild, as does everyone in the Guild operation except for the Guild core staff. And I work from my office in one of the Chicago suburbs in Wheaton. I see about 30 private clients a week. In addition to that, I do a major hospital clinic, which is the first medically approved hospital-based program in America for the hypnotic treatment of cancer. And I do 2 free clinics as well at area wellness centers. About 70% of my clientele are cancer patients, but the largest group after that are individuals who have rheumatoid problems. Chronic pain, basically, is what we're dealing with. I am very sympathetic to this constituency, in large measure because my own wife, Lindsay, has severe osteoarthritis and has had it since childhood. So I see firsthand what chronic pain does to a person, so I care very deeply about. Because of that, I've got interested in working with arthritic rheumatoid conditions, of which fibromyalgia is one, and began to develop techniques which over the years have proven to be successful. I work routinely with the American Arthritis Foundation now in doing workshops for people with fibromyalgia or other arthritic problems. In fact, I'll be doing one shortly after we get back from the convention. We've got a fairly elaborate handout for you. So I'm going to just ask you to take one and pass them back on the side. And over here, and as I said, we're trying to get some reprinted. If you're here as a couple, just take one, and worst comes to worst, look on. Come up here after the workshop, give me your business card. I will mail you one or email you one. And I'm going to cover all the material in the handout through the presentation, so you're not going to lose anything. Now, as we work with this, I want to remind you all that according to the Guild Code of Ethics, to work with a medical condition like these, you do need to have a proper referral from a licensed healthcare professional. This will typically be the physician of the patient who's come to you as a client. And you want to be sure to get those referrals. First, it's required legally in many states, but also just straightforwardly, no one is more frustrated in working with chronic pain than your average American caring physician. And if you've got something that works, and they see that you can really help these people, it will guarantee you a flow of clients from that referral source. Perhaps in no other area of work, other than pain control, are physicians as willing to work hand in hand with a hypnotist. And this is because pain is debilitating and awful, and there isn't a whole lot that touches some of the pains that we're going to be dealing with here. Bone pain especially, such as you get with osteoarthritis, is intractable, even to the strongest narcotics. And some of the neurological disorders we'll be talking about here, like ankylosing spondylitis, are so painful that even the latest drugs, like Neurontin and stuff, don't make that much headway against the disease. So if a physician knows that you can help, you're going to get regular referrals from that physician. So you want to get those referrals to begin with, to establish those relationships. You want to send a nice letter to the doctor after you've done the intake, informing them that you are treating the client on referral and saying some things about the client. When the client finishes up, you want to follow it up.